Okay, so again, good afternoon. Our topic for this afternoon is all about uh, the National E-Health Program of the Department of Health, which also has been part of the Health Information and Management System. The learning outcomes for this afternoon is related on how the National E-Health Program are being implemented by the Department of the Health, and how the National E-Health Program are in place to help the various healthcare sector when it comes to the use of the information science, the technology, and at the same time, the nursing informatics. So the health information and management system are considered on how the Department of Health and our government consider the direction when it comes to the use of the digitalization, the technology in our healthcare system. We are aware that we are implementing the Universal Healthcare or UHC, which is already a law, and the implementation of the Universal Healthcare entails the use of the health information and management system. So that's why we have the eHealth Philippines. Actually, as the e-health is considered as from the perspective of the health information and management systems, this entails the application of internet and related technology to the healthcare industry. So nowadays, internet is a part of our lives when it comes to the connectivity, when it comes to usability and applicability. Because nowadays we are using this technology, we're using this access and the platform to do our coordination and communication. Since most in our work arrangement setup, just like in our institution, that we are on the work from home uh, flexible work arrangement. And due to the constraints and the declaration of the community quarantine, the school has not yet implementing the limited face-to-face due to the health risk. So the e-health may not just only be applicable when it comes to practice. As what I have told you before, we have various areas of nursing. So we have the education, we have the practice, we have the administration, and we have the research. So these four key areas are significant when it comes to the e-health also. And when it comes to the application of internet and technology in the healthcare industry, if you can still remember the definition of our nursing informatics, these are interrelated concepts. What are those interrelated concepts that we considered in nursing informatics? We use the information science. It is on how the nurse process collection, gathering of data, uh, storage of data, and as well as security and protection of data. So that pertains to the information science. We consider the nursing science as the acquired competencies such as the knowledge, the skills, and attitude, and with the integration of the technology. And the computer science as a concept wherein we use various platform, uh, software applications, hardware. So this is on how technically it will process the storage access of of our information. So those that the concern on the use of the application of the internet and related technology in the healthcare industry to improve the access, efficiency, effectiveness, and quality of clinical and business processes. So the healthcare industry that we're talking about is, again, not just confined into the concept of hospital. It may be also in the public health, which is on a community health center, which could be also in the city health office, which could be also on a regional and provincial or regional level, and it could be national or global. So those are the what we call healthcare industry. Whenever it uses technology and the use of the application of the internet, that concerns with the e-health as according to Health Information and Management Systems Society. If the purpose of the e-health is to improve the access if we're considering the access, it is on how a nurse may retrieve information. But using the access could be more relevant if the nurse can easily, immediately retrieve information, which may consider the time frame. Okay, unlike on a manual retrieval of the information and records, we all know that it will take time. But if we use the access using this technology, then it would be easy for us to have and retrieve those needed information. To improve efficiency, the efficiency as what we have defined in the topic as we discussed the nursing and knowledge, efficiency refers to the maximum use of resources. Okay? So it means that manpower, the machine, the money that is referring to budget allocation, to the time, okay, and through the resources available. If these are collectively and together maximized by the nurse so that to consider the concept of e-health, then that's its purpose of improving. Now, when it comes to effectiveness, when the organization met the standards, that's a measure of effectiveness. When the nurse uses e-health and it attended to the client's emergency condition, and it prevented complication, and after the hospitalization have recovered and discharged with no complications, those are measures of effectiveness. If e-health is used also, okay, e-health is used also on the use of the internet and the technology, and as well as those platforms that are being used by these hospitals. If this improve the operations of the hospital, from the admission to the billing to the charging to the inventory, then the client's satisfaction is highly recognized. So that's a measure of effectiveness. When it comes to the quality of clinical and business processes, the clinical is referring to the patients, okay, the clients, okay. The business processes are referring to what? The business processes are referring to the operations of the healthcare facility, which, if we consider the quality of clinical, the use of the technology may help the professionals, the healthcare professionals, to immediately, effectively manage clients' health demands. When it comes to the business operations, if the organization becomes efficient, maximizes the resources, and effective, meets the expectations of the stakeholders, then that becomes an improved business process, which mentioned as utilized by healthcare organization, practitioners, patients, and consumer. So the healthcare organizations that we are talking about are those that, for example, the standards that a hospital is considered to sustain its quality operations. This is based from the healthcare organizations. From practitioners, patients, and consumers, they are considered as the stakeholders. And we all know for a fact that the core objective of having this e-health is to improve the health status of patients, either on a community level or in a hospital level. So, if we will try to check on the e-health as a primary concern when it comes to the nursing informatics, it considers improved access, number one. Two, efficiency, maximizes resources. Effectiveness, number three, if it met or meet the expectations. Quality of clinical, if the client's health demands had been met. Business processes, if there is an effective and efficient operations of the healthcare facility. So this is referring to e-health. Actually, there are challenges of today's health system. Actually, the kalusugan pangkalahatan is referring to universal healthcare. And in the DOH, we have the Formula Plus One. This is the flagship program on how the universal healthcare will be effectively delivered to all the people. The challenges of today's health system refers to the access to healthcare services and access to real-time information for the decision making. So, access to healthcare services. For example, in a community health level in the public health, not all people, not all people in the community knows the basic services of health center. Actually, the Department of Health, when it comes to the public health services, uh, this must be all accessible to the health centers in the community. However, there are restrictions, there are limitations, there are scarcities when it comes to manpower, when it comes to resources, supplies, equipment, when it comes to internet connectivity. When health centers are located in remote areas, there are limitations with connectivity. If there are no internet sites that may have access on the internet, specifically if the health centers are in the areas wherein transportation is also a problem. Another, if the healthcare services is considered as an access the healthcare services is a problem if the the community is not technology driven. Okay, so it sets limitations when it comes to immediate access of the services. So for example, um, each community is expected to have maternal and child health care services. So sometimes in some of the regions, in some of the localities, some of the health centers may not have access to internet so that to support the data. Uh, for example, in areas like in Mindanao, if they will be asked who among the frontliners, for example, in the health centers specifically, are not yet vaccinated. Why this information is very important? So that to support the supply of number of vaccines that will be allocated to that locality. But since it sets limitations to the internet connectivity, it sets also limitations to the access of the information. So that's why we go back to the definition of e-health. If we are talking about improving access, efficiency, effectiveness, uh, improving quality of clinical and business processes, this is somehow some of the challenges that a healthcare facility in the community may encounter. The database registry, for example, if a health center doesn't have a strong storage and security of data, if they will be asked by the national office on how many COVID-19 cases do you have, they may reply eventually based from their manual records the number. But if the Department of Health will ask how many are mild, moderate, and severe cases, so that's another story, because if that health center is not organized when it comes to the storage of data and access of data pertaining to that situation, then this may cause a difference with the time frame. Okay, probably the people in the health center may do an actual survey, unlike if there will be a stored data and information in their access of on their computers. They can easily give feedback to the Department of Health. Now, if we are referring to access to real-time of information for decision making, if we say real-time information, the most updated and timely information, even a minute of the condition of the client has been recorded. Okay, so this is now again a challenge when it comes to access to real-time information for decision making. If, for example, the client goes to the emergency room who is unconscious, so the challenge is how to do patient history, how to do medical history, how you will gather medication history, and you will just rely on the immediate relatives or for the guardians who are attending to the client. But if the client has the access to the hospital portal, he keeps on updating the history or his history, so that whenever the specialist wish to access his information and history, he can just access. And since it leaded to a situation of emergency, in just one click, the doctor can access the latest information that the client have, so that it may support the appropriate treatment. It may support prevention when it comes to if there are any allergic reactions to drugs. So if that happens, that there is already a mobile application that will directly update the information of the client into the hospital setting, then this could be what we call efficiency. But again, this serves as a challenge because not all areas in the Philippines may have those resources and may have the access to internet. Somehow, the e-health actually can provide solutions to achieve goals and hurdle the challenges of kalusugang pangkalahatan. The kalusugang pangkalahatan is the same as on the universal healthcare. Just like, for example, if we say universal healthcare, it's health for all. That's why it's kalusugan pangkalahatan. Uh, if for every population group, such as community, deserve to have manpower for each health center, then there must be manpower for each health center. Now, if the Department of Health will ask, how many health centers active health centers do we have now all over the Philippines? If the city health offices may have the record, may have the record of the active health centers that serves the community of their locality, then it could be easy to just send this data and information to Department of Health. But if it is manual and not updated, then this could hinder, okay, a real-time information that may prevent the actual number of manpower that is needed for the Department of the Health. So those are situations. Okay. Now, actually, this is the National E-Health Vision, and try to imagine that it is supposedly, since this was a vision way back 5 years ago, and the National E-Health Vision was formulated that expected by 2020, the e-health will enable widespread to healthcare services, health information, securely shared exchange patients' information in support to quality healthcare, more equitable, responsive health system for all Filipinos by transforming the way of information is used to plan, manage, deliver, and monitor health services. Now, if you will try to evaluate, okay, regardless of the situation in the 2020 when it started, the pandemic, actually in the year 2020, the e-health vision must be in place already. On what aspect? On the information dissemination about COVID-19. If the e-health, national e-health is in place, the access for the number of cases all over the country can be accessed in just one glimpse. If you will try to recall, during the start of the pandemic in the March 2020, the updates in the number of cases is usually every other day or every other 2 days, because there is still no system in place to trace the number of cases, confirmed cases. And during that time, there is also a limitations when it comes to test kits during that time at the start of the pandemic. So, but somehow we could identify symptomatics already, even not tested, because they have been prioritized supposedly for the test. But during the time of 2020, and it was March, if I remember, March 16, those technology that we expected for the access of the information must already be in place. But it started to a point of still formulating guidelines on how to implement such gathering and collection of information. So 2020 is really a challenge, but considering the national e-health vision, it is also supposedly expected. Widespread. If they have used the widespread, it's from Luzon, Visayas, and Mindanao. From Apari or from Batanes or from Apari up to Holo, this e-health must be in place. But again, there is a possibility that the access for the budget allocation was diverted into other means rather than to support the implementation of the national e-health. So those are on the other side of the story, which is supposedly the transformation of the information and access must be in place when it comes to how it was planned, managed, delivered, and monitor healthcare services. For example, that's what you call real time. If I ask you immediately, for example, we are now on the 4:20 p.m. Then if the Department of Health, if we will ask the Department of Health as of 4 p.m., what is the updated number of deaths, recoveries, and active cases? They could give us easily information because they have already the system in place as part of the e-health vision. Okay, but it's already 2021. Let us see if what are the, again, the roadmap that the DOH are in place when it comes to the national e-health. Actually, the Department of Health has this knowledge management and information system and technology, which is the what we call KMITS, technology and system. So they are the ones that manages specifically related to this e-health. Eventually, when it comes to the national e-health vision which we have mentioned, these are actually the 5 areas which may achieve supposedly the national e-health. Example, IT enabled services, okay, are referring to the services that can access the use of a platform to gather information, okay, access to information. IT in all public health facilities, the public health facilities are referring to the facilities from the community, okay, community up to the hospital level and specialty hospital agencies. So, for example, when a client when the client reside in Mindanao and will eventually unexpectedly will deliver for normal spontaneous delivery here in Manila. Now, how the healthcare team can access the information to Mindanao? So this is now a concern. If, for example, if the client undergone prenatal consultation, okay, or during the consultations in the health center, how the specialist or her obstetrician can access the information from the health center where she consulted in Mindanao. So if this will not be possible, again, it will start from the processing of information to ask again the client for her history, her obstetrical history. Unlike with, if there is IT infrastructure or infrastructure that had been in place, the the hospital can just access to the health center. So the basic information that the client may reveal is what health center, what locality or health center did she consulted during her during or prior to her delivery on that date. So that's the point of why IT in all public health facilities are important. Although they have some hesitancies pertaining to the security. But since we do have the Data Privacy Act already, then this could be helpful when it comes to what? This could be helpful as provision to protect the data of the client. Another, we have EMR certification, electronic medical record certification. What do you mean by electronic medical record certification? So if the facility is capable and may have capacity to apply the certain measures on information technology in the um, protection, access, and protection, access, and specifically processing of information, then this may be helpful when it comes to what? When it comes to the services being rendered by that center. So they will be given supposedly EMR certification, or those who may have EMR certification, it may not be anymore the information of the client may not be anymore in the index cards. It will be already in the EMR system or process. Next, we have the health data standards use. The health data standards use is on a national level, wherein if we will try to use the vital statistics, this is referring to the quantitative data that it could be centralized on a national level. So as what I've told you, that's why nowadays the Department of Health may have the specific measures to gather and update us data every 4 p.m. because they have the systems in place. Another is we have the Philippine Philippine Health Insurance PHIE, Philippine Health Information Exchange. Okay, the Philippine Health Information Exchange implementation is specifically considered when one agency could be specifically what. Okay, sorry for that interruption. So we may have specifically these measures to consider on how the health data standard use, and the other one is, as what I mentioned, the Philippine Health Information Exchange. The Philippine Health Information Exchange is from one agency to another agency. For example, it's the ILG to Department of Health to the national government. So this is the Philippine Health Information Exchange, which will use the various platform. Okay. So before we continue, let me have first a 2 minute, rather a 5 minute break. Okay. A 5 minute break. I will just attend to some of the documents to be signed from the Philippine Nurses Association. So just wait me for a while. Okay, so let us now continue. Okay, now if on the okay, so if you will notice, this is actually the framework on the how it should supposedly uh consider the national e-health vision. It has the four areas: health information, healthcare activities, healthcare services, excuse me, and health records. So we are gearing towards supposedly on a picture that the widespread expectations on the four areas of e-health or national e-health is already in place with the platform and can be accessed using the internet, application of internet and technology. Just like for health information. For health information, we have the Department of Health may give us updated information on health reports such as top leading cause of deaths of 2020, top leading cause of morbidity, top leading causes of injury as of 2020. But in reality, this data that are these data that are uh, specifically requested in the Department of Health, their updated data is 2018. So can you imagine there's a delay of almost 2 to 3 years on the updates. So the National E-Health supposedly may have the real-time information na it's supposedly as of April 2021 you can access the updated numbers. So sometimes there is a problem with the synchronization. Just like, for example, how many nurses do we have in the country? This has been a dilemma. There are different figures from the OH, there are different figures from the Philippine Nurses Association, there could be different figures from the PRC, Board of Nursing. However, it was now one of the primary agenda on how it will synchronize these numbers. So going back to this health information and health reports, manpower reports are also supposedly may have real-time information. So yun, that's supposedly as expected. Uh, Another is health records. So for example, a client in the health center, primary hospital, government institutions can can access the health record from personal medication, medical histories, examinations, and procedures. If the client had been hospitalized in 4 hospitals, for example, the client has been hospitalized in Mindanao, Visayas, and in Luzon. So historically, we need to know the record of the client through the health record. So it could be easily accessed if there is already a platform in place so that whenever it will type the patient code, so for security of the client, it can identify all the records. Okay, anyway, again, as what I mentioned, there is already a data privacy act to protect these patients. So healthcare services, so when it comes to the healthcare services. This could be pharmacy, diagnostic services, hospital, health providers. So the healthcare services, for example, we could have a mobile application to specifically just like a search engine na uh, what pharmacy services nearby. Okay, are nearby. So it can identify within your locality the pharmacy services. Another, uh, within the community who is certified first aiders. So once you access those search engine, the one that is nearby is the one supposedly may attend to you. So it can easily access that it can record, for example, all certified first aiders. But then once you type your locality, you can access the service of individuals who can attend to you. So another is most of the time, and nowadays, diagnostic services are done on home service due to the situation, the public health situation. So, diagnostic services that may have the swab test So once in the search engine of a certain application can identify what are the diagnostic centers nearby and may do home service. So those are situations that supposedly in place. Healthcare activities such as the DOH programs, okay, that by which, for example, for this month, although they have indicated their programs that can be accessed on their website, however, the actual implementation and the details are not in the website. So unlike if there will be an application or a website or a link which they can access the specific activities. So if you will see that the National E-Health Vision must consider a safer, quality healthcare, equitable, that is for all, and responsive health system. This is the core goal and objective of supposedly the National E-Health. Now, when it comes to the context settings, can you imagine that the Philippine government had already a development plan? The development plan that started 2011, 2016, Philippine e-government master plan of 2030 to 2016, Philippine digital strategy of 2011, 2016, that is anchored by, actually it's not anymore MDGs, it's already SDGs, the Sustainable Development Goals already. And the national objectives of health in 2011-2016 is anchored with the World Health Organization. So can you imagine in this year of 2011 up to the 2016 rather, that the information and system strategic plan is supposedly in place even in 2016. And the Philippine e-health strategic framework has the plan and it is expected that it could be in place in 2017. So can you imagine this context setting way back? So there are many factors. There could be possibilities that there are no continuity because of the change in the government, those who are in the government, and sometimes may not support these programs. So if there is someone who is new and may have plans different from the one that had been started in 2011, so there is no continuity in the development. So supposedly, the Philippine Health Information System may consider these services, frontline services, regulations. So those policies can be accessed. Pharmacy services. So if you are looking for over-the-counter drugs, the pharmacy services, FDA-approved drugs, community-based services, what are the DOH programs? Disease registries and surveillance. The disease registries and surveillance refers to the vital statistics, okay, the morbidity rate, the mortality rate. The health finance and insurance is referring to PhilHealth. So we have problems with PhilHealth because of some concerns, but eventually you can access your PhilHealth contributions through this framework. Human resources in health. So supposedly in just one click, number of nurses as of 2020, then we could access in this area. Environmental monitoring, if this refers to information of climate change, diagnostic services, health service delivery, for example, what are those institutions of primary, secondary, and tertiary hospital, health supply chain. The health supply chain are those in charge of for example, with the vaccines, they are in charge on how the vaccines will be protected, on how it will be delivered, on how it could be stored. So those are emergency response if the community or the families may need emergency, so through the web services. So can you imagine the 2, 4, 6, 8, 10 services are supposedly in plan, but what happened? So actually, in the 66 World Health Assembly, it is supposedly part of the roadmap. And these are part of the overall national e-health strategy. And this come up with the what we call Philippines e-health strategic framework and plan. This is already the result of comprehending what Philippines need to achieve in order to address health goals and challenges. So the use of technology, the systems, and operations, it is combined. It's all about the Philippines e-health strategic framework and plan. So the next question is, what happened with the vision of the 2020? Actually, the Pliance e-health strategic guiding principles, these are some of the concepts on why there is an existing Philippines e-health strategy. So client focus or person-centered information. So if ever individualized records are in the electronic medical records, collaboration and partnership with different stakeholders, for example, with different expertise of the healthcare team, nurses, doctors, and other professions, that the collaboration with the different stakeholders could be holistic. The user's involvement, this refers to the clients on how he is involved specifically in the healthcare system. Harmonization and independence. Remember, we discussed about telehealth, telemedicine, and telemonitoring. And with the telemedicine, telehealth, and telemonitoring, this may provide independence, even not the person is not physically in the facility, but it may have clinical decision on the part of the client guided by a certain platform. So next is recognized presence of entities that already started e-health. So for example, there are already platforms that are being used. You have been oriented with Bitsbox. Bitsbox is a hospital information system, and it was established in 2006. So can you imagine, it was 2006 that have been established, and yet it just have been upgraded. So it is already in place. All we have to do is to upgrade it accordingly. So are all hospitals using it? So probably by a different platform. Next is availability of human resource. We may need specific expertise on the information or IT specialists, compliance of laws and regulations, so that it will be easy for us, nurses and healthcare team, to identify if we are in compliance with the standards of laws. So optimize use of resources, maximize use of resources is, for example, if we do have the e-health, we could just identify example, use of resources, optimize maximum resources is referring to number of vaccines, number of syringes. If your target is 500 and your number of vaccines is 300, how you will strategize it? So what will be your basis? Your basis is the IATF category. The A1, the A2, the A3, and the A4, because we have limited 300 vaccines. So those are examples that, wow, we do have the target of 500, but we could only have 300. So if we will access the information of the A1, for example, number of the number registry of senior citizen in Bulacan or in specific locality. One click, then search engine, then it gives you the information and the list as well. So it will be easy for us to make plans accordingly on the real-time information. So actually, we will discuss one by one on the Philippines e-health components. The Philippine e-health components are the following. We have governance, we have legislation, we have e-health solutions, and we have standards and operability. So we will discuss it one by one. So let's have first the number one. The governance includes management of e-health agenda, operations management, monitoring and evaluation, policy oversight, network and collaboration, strategic structure, and we have the clinical safety. Okay. So this is under the governance of the Philippine e-health components. And actually, this is leadership and governance of multi-sector engagement. Um, the key explanation on this when it comes to leadership, governance, and multi-sector engagement is on the e-health goals, on how e-health goals, strategies, and activities at all levels will be in place. Okay, so it has presented that we have vision. It has presented that we have strategies. It has presented that all of these components under the governance are in place at all levels. What do you mean at all levels? From the community level to the locality to the provincial, regional, national. But taken into consideration that all of these strategies may require policies, may require networking, may require operations and systems. So this is the one that being emphasized when it comes to leadership governance. So again, it is on how the e-health goals and strategies and activities at all levels will be coordinated. So a typical example vaccination program. On the vaccination program, our target is universal healthcare to vaccinate all Filipinos. However, it sets limitations based from the literature of vaccines that it must be with a certain age and above. Okay? So 18 and above, for example, can only receive vaccines because there is still no clinical trials for 16 years old and below. So that's why they are not yet included as part of the population group with the vaccination program. So you have in mind, you have already the vaccines as supply, but what could be the strategy on how it will be implemented? So one of the consideration is what is the epicenter of the COVID-19? The epicenter of the COVID-19 cases is NCR. So let's have a plan that will only consider what? That will only consider NCR for the meantime as a priority, okay? Priority area for vaccination, which may implement all the categories set by the IATF. So this will depend on the person, on the leader, on how this will be systematized and on how this will be implemented accordingly. So that is what we call leadership, governance, and multi-sector engagement. Number two is all about legislation, policy, and compliance. Okay, if we are talking about legislation, policy, and compliance, this refers to national policies, legislation, and protocols. Okay, let's go. Let's proceed to the present situation of public health emergencies. So, do we have a specific law that focuses on our response with the COVID-19? Yes, we have Bayanihan Act 1, we have the Bayanihan Act 2. Okay, do we have advisories coming from the DOH? Okay, coming from the DOH referring to protocols. The answer is yes. Next, do we have standards on minimum health protocols? The answer is yes. Do we have agencies that attends to the problems of the hospital? The answer is yes, DOH. Do we have a policy on the distribution of the social work assistance? The answer is yes, the SWD, local government units. Now, if we are talking about the distribution, that's another story. The distribution must entail guidelines, and those guidelines will be the reference on how to register those recipients and beneficiaries. Okay, for vaccination program and for those who will receive the assistance from the government. So, if you will notice, we have the laws and policies, which is the Bayanihan Act 1 and 2. We have also the legislation and policies when it comes to Data Privacy Act. Okay, so this is referring to the safety. When it comes to national health identifier, this refers to the specific guidelines on the prioritization when it comes to the programs. Health data standards and software certification is referring to how the facility is capable of rendering the services using the technology. So again, in the leadership, we're talking about setting the goals. Okay, when we talk about legislation, policies, and compliance, this refers to the national legislation and protocols that will help to attain the e-health vision. Next is all about the standards and interoperability. If we say standards and interoperability, this may serve as our reference for collection and exchange of health information. Okay, let's face it, all the data that has been gathered can be used for research development. So that's why under the standards of interoperability, there's research development. When we talk about specific dictionary or glossary of what they call these terms that are very technical, we could have search engines to the Department of Health whenever we need information. So it is just referring the standards and interoperability is consistency and accuracy. These are the two terms that are very significant when it comes to standards. Okay? So next, we have the e-health solutions. So the e-health solutions, if you will notice, we have information sources, delivery of services, information flows, human resources, infrastructures, strategy and investment. So they have provided us with e-health solutions. This is all about applications and services that can be accessed through online through the use of the internet. And these are expected widespread. Okay, regardless of the stature of the locality. Okay, so this is expected that it requires core system services and application. If you say core system, one system is being used all over the country. If if this could be used, then there must be a strong connectivity with all the areas in the country. But as of now, when we talk about the implementation of the flexible learning system, this is still one of the concerns to those remote areas. Okay, even in those areas that may not reach those favorable connections or connectivity. So how this could be implemented? So there must be an assessment first of what those areas may need primary and urgent attention before this will be implemented. So, as what I have told you, it has presented these e-health solutions as supposedly widespread, but the change in the government line up and even with those who are in charge may not have those continuity and possibly may have transition to another direction. So those are factors. So next is web infrastructure. The infrastructure is very important when it comes to the implementation of e-health because this is referring to connectivity, storage, security, standards, computing infrastructure, database, and directory services. So technically, it's the infrastructure that we're talking about is the operationalization of the health information exchange. So how it could be efficient. For example, if we're doing this discussion, then eventually the use of the platforms such as the Zoom and all of us may have good connectivity. The exchange of information is clear. Okay, the operation of our delivery of instruction is clear, and this is what we call infrastructure. The connectivity check. Storage is in our MCU BLE. The security, we do have the such provisions on passwords, and the standards are also in place when it comes to the guidelines on the use of the VLE. So those are examples. So just like for example in the national level, from the DOH, it must be the same information exchange in all agencies. But again, it's has limitations because probably they may have different platforms that are using or problem with any of this connectivity, storage, security, and standards. Next, human resources. The human resources are very important because we need also to train people who to use this e-health. So the workforce, if you're talking about human resources, workforce or manpower. Okay? So who are those people who may help us? Siyempre, the nurses must have the education and training. But when it comes to the e-health in the line of work, we may need information and communication technology workers or experts who will align our competencies in as healthcare providers. So that's why nursing informatics had been integrated already in the curriculum, so that for you to know that the use of nursing informatics is already part of our competencies as you earn the BSN degree. So number seven is strategy and investment. The strategy that we're talking about is part of the planning and how this could be sustained. Although, again, this is a problem when it comes to sustainability because when we talk about strategy and investment, this refers to the sustained national e-health vision. So I have presented to you the national e-health vision of 2020. But if you will try to have the realization with the term widespread, then in reality, we may have the basis that we are not yet meeting our vision. So we are awaiting if there is a new roadmap from 2021 onwards by the DOH. However, if you will notice, it started already in 2013 up to the 2020. Supposedly, the phase one is on the phase of connect, phase two is on the transformation, and 2020 is maintain and measure. So from the plan, the phase three is supposedly if it is already in place and how it is sustained. We expect 2021 is to measure the sustainability already because all of these phases are already in place. However, this is the transition that has been in place. Supposedly, we have the RX box. This is a platform na wherein it could access the information from community level up to the hospital level. The example that I gave to you is if the client had been is from Mindanao and she is about to deliver in Manila. So the RX box is the one or the platform that is supposedly can be used to access the information on the community level. So the iClinics are already in place, but this is a platform by which it's on a community health service level. This focus on the vital statistics, demographics of the population. But the problem again is I have interviewed some of the experts in the DOH. They still have the problem on this because it's not compatible with all of the setup all over the country. So PhilHealth is supposedly the one target to supposedly consider in the national e-health plan. So 2015, 2016, supposedly this is already in place as per implementation, and 2020 is supposedly innovations already. So these are the components supposedly that the action lines that have been done. So change and adoption is more on the manpower, e-health solution, services and application. This is the foundation. So we have mentioned about the e-health components. So the governance are on the governance and strategy. So this is on the governance. Foundation, this is on how the e-health will be implemented. The solutions are obviously referring to the services and application, and change in adoption of the manpower is significant. So I think I may end up to this topic. Okay, and this is the all of the topics. Up to this is the topic that we considered for the midterm period. So thank you very much.